it's me. Here's the video like I said I was going to do. I chose to do this video to not only bring awareness for people with my condition, but to kind of let my friends and family know what I am going through on a daily basis, what is it like, exactly what is my condition, and so that's what this video is going to be about. I have been living with this my whole life. I just found out this past May that I had what's called Chiari Malformation Type 1. And basically what that means is that here's a picture of my brain and my MRI. And right here you can see the cerebellar tonsils. And this part of the brain controls like movement, balance, coordination, things like that. And this is not supposed to be pointing downwards. This is the base opening of the skull right here. And this is the brain stem. And this is my cerebellar tonsils. Now all of this should not be sloped down this way. It should all be resting about here. Or maybe a little higher, I'm not too sure. My herniation is caused by this part of my skull not forming correctly and having overall general crowding in the skull. And here is where it grew inwards too far and started pushing down on these cerebellar tonsils as I started growing up. And once you reach about, I would say your early 20s and you stop growing, that's when Chiari really can show itself in adults, because once you stop growing and your skull stops growing, there no longer is any room for the brain. And so what Chiari means a malformation of the skull. It's not having enough room to contain the entire brain. And so this is a separate part of the brain called the cerebellar tonsils, and this is the main part of the brain right here. Okay, and so this descending down into the spinal cord, compressing the brain stem, as you can see here, can cause many different problems. Many different problems. This area right here, they call that tenting. That's when there is such a degree of sloping that this starts to form a triangular point, because this has all been pushed down, as you can see. And as my neurologist explained it to me, right here is another problem area where my skull just kind of said it didn't want to pop out, I guess, or round out. And so that caused a little bit of crowding here, which in turn caused a more severe drop of the tonsils in this area. So, it depends on the person whether or not you will be a symptomatic Chiarian. There can be some people with Chiari malformation that never have a symptom in their whole life. There are some people who have Chiari malformation that have over 200 different symptoms. It's wild. I fall about in the middle of that scale. I have anywhere from about, well, before surgery, 60 to 70 different symptoms, and sometimes all of them at the same time, some of them every day. Crushing migraines, what feels like migraines, mostly at the back where the compression is happening. There were days I felt like I had moving spiders in a beard all along my face, just constant moving. So I ended up going through several different doctors before I found a neurosurgeon that actually knew what he was doing. The whole purpose of this video, like I said, is not only to bring awareness, but to help educate some of my friends and family who, aren't too familiar with it. And it's no wonder, because it's a very rare condition. And as it sits now, I think it affects 1 in 1,000 different people. How is it treated? There is no cure for Chiari malformation. You will live this way for the rest of your life. There is no magic cure. There is no pill that can make your head larger. There is nothing that can shrink your brain, which you wouldn't want to do that anyway. So we're forced to live this way for the rest of our lives in horrible, excruciating agony. The brain stem, as I showed you in the MRI, being compressed by the cerebellar tonsils having descended into the spinal canal can cause a myriad of different problems. It can cause issues with speech, walking, coherency, short-term, long-term memory loss. It can also, as you're growing up, affect your pituitary gland, which can, cause things like slow puberty onset. It can cause, once your body starts catching all up at once, it's like everything starts growing too quickly. That happened to me. I was a very late bloomer in life. I didn't hit puberty until I was nearly 14 years old because of this Chiari. And it's funny that I've lived this way my entire life, and I never even imagined it had something to do with my brain. But I had to know that there was something. And first of all, I just want to say thank you to all the people that stood by me, my husband, my family, my closest friends, who never stopped believing that there was something wrong, that it wasn't all in my head, that I wasn't going crazy, that there was something very real and very frightening happening to me. And some of the symptoms that it would cause are so scary that you begin to wonder if you're dying, because it really feels that way. One of the symptoms that I've had, one of the very first symptoms I ever had, started when I was 8 years old. I started having syncope episodes, which means fainting. I started fainting for no reason, and I started noticing as it kept happening all my life. It happens maybe a couple times a year at most, or sometimes once every other year. It's so bizarre. There is no way to track it properly or know when it's going to happen or what's going to trigger it to happen. It just happens. And so one of the last times that it happened, the symptoms became so severe that I thought I was having a stroke or a seizure. And when you start thinking about how serious that can be, you really get a fire under you that just moves you to go get that diagnosis. And don't get disappointed when doctors tell you they don't believe you, or you're a hypochondriac, or it's all in your head, or you're drug-seeking, pill-popping drug addict. And I've heard them all. I've heard them all. Unfortunately, these days, doctors are trained to assume the worst and then relax when they find out it's not the worst, and I think that's very messed up. Doctors are here to care for us, not to judge us. They are not our judge and jury. So, surgery is the only treatment available for Chiari malformation, and what that means is surgery is not a cure. It's a preventative measure. It also helps to take the compression off. Let me bring this up again. What happens in surgery is they cut away pieces of the skull to make more room in this area for the cerebellar tonsils. They also removed or shaved down my C1 vertebrae to make more room as well. I was in ICU for 2 days and nights. I was in the hospital for a total of 5 days after my surgery. Incredibly painful. I had 16 stitches up the back of my head. It's hard to explain this condition to some people because they can't even fathom what it's like to live like you're being tortured every single day. And it's hard when people look at you either like they pity you, or they don't know how to help, or they don't believe you. It can be very disheartening when even doctors don't believe you. There are so many doctors that have never even heard of Chiari malformation. It's a crying shame. Surgery is not a cure in the fact that when a person with Chiari malformation has surgery, it's kind of like a three-sided coin toss. I know that doesn't make a lot of sense, but it's all I can think of right now. And basically what that means is that you're going to go in, you're going to have the surgery, and one of three things is going to happen. Either you're going to get better, you're going to get worse, or there will be no change at all. My situation when I went into surgery, I was so hopeful that this was going to be the answer to everything and that it was going to help me feel so much better. And the reality is that recovery from this surgery, even though they tell you the recovery period is 3 months, it can last up to a year to recover fully from this surgery. I mean, they dissect neck muscles. They literally held my head open with 60-pound weights. I mean, it was some pretty intense physical trauma to the cranium. And so I remember when I was being brought out of surgery, or waking up from surgery, that I couldn't even clear my throat because just the simple caused such fiery hot pain in the back of my head. I mean, this is major surgery. Major surgery. I ended up being very lucky in having one of the best neurosurgeons in the entire world. He's a rock star. So very lucky, and I know God had his hand on me through that. Why is surgery not a cure? Surgery isn't a cure because, like I said, it's a flip of a coin. You can either go in there worse off than when you started, or you can go in there feeling better, or you can go in there and come out worse off than you were before. And for me, I'm kind of in the middle. I've had some relief from the skull-crushing, kill-me-now headaches that happen with Chiari. My speech has improved a little bit. My walking has improved a little bit. I'm no longer having to use a walker. I am still bedridden. I am still in so much pain. It's unreal. My only, company is my husband and my kids, and the internet and movies and television. That's pretty much all I have to do. I'd love to be out there taking a jog, or going out to the lake, or visiting with friends, or being spontaneous, but I just had to make peace with the fact that that's not my life anymore. I will constantly have to base my life around how I'm feeling for the rest of my life. Surgery isn't a cure because when you have it, there's no guarantee that you're going to feel better, like I said, and it's not curing Chiari. There is no cure for Chiari malformation. And so what that does is it prevents having the surgery. It prevents becoming paralyzed in the future, or further nerve damage happening, losing functions of your body, stroke. Having a stroke is a real possibility. Having seizures is a possibility. I mean, possibilities are nearly endless. And so when people are surprised when I tell them I'm not better after having surgery, I have to explain over and over again, surgery is not a cure. Now, that's not saying that I am against having the surgery. I had the surgery. I would have it again if I needed to. It's about how willing are you to do what it takes to have a better life, better quality of life. How brave are you going to be so that there's even just a possibility of having some better quality of life? It affects me in so many different ways because it's not just Chiari. I'm now finding out that there are sister conditions that come along with Chiari that I might possibly have. One is called Ehlers-Danlos syndrome, and I made this. It's just little information. Ehlers-Danlos syndrome affects the joints, your vascular system, skin. You bruise easily. Basically, the joints are very hypermobile, where you can end up nearly touching your thumb to your forearm. You can nearly bend your fingers all the way back. The range of motion is freakish in people with Ehlers-Danlos syndrome. I can't tell you how many times I've been called a contortionist. And while some people may say, oh, well, being super flexible isn't a bad thing, it is. It causes extreme arthritic-like pain in all the joints, only it's not the same joints every time. It switches from joint to joint to joint, and it can last for months. So my left shoulder has been acting up. This is going on 5 months now that my shoulder feels like it has been either dislocated or sprained somehow, or torn a tendon, whatever, what have you. But it has been hurting for a solid 5 months, and it will hurt into the bone. It hurts. And it radiates all down my arm to where I can't even use my arm anymore. I have crutches. I have 9 kinds of different braces. I have an arm sling. I have a neck brace. I have a cane. I have a walker. It's never ending because I never know which joint is going to be affected, and I have to be prepared. Another one of the sister conditions that one can have, bear with me, This is postural orthostatic tachycardia syndrome, or POTS for short. And what POTS is, it affects the heart rate, blood circulation, how well you can tolerate standing after sitting down, and not having enough blood flow throughout the body. This can cause things like fainting. It can cause rapid heartbeat or even a weak heartbeat, extremities, pins and needles feelings because your limbs are going a little numb without circulation. For instance, when I stand up after sitting down or lying down, the blood rushes from my head and my vision will fade, and I have to grab onto something because there's not enough oxygen getting back, or not enough blood and oxygen getting back up to my brain. So those are the two conditions I'm going to be getting tested for. Ehlers-Danlos syndrome, I will be seeing a geneticist for the first time on Halloween, which is tomorrow. Hopefully that will go well and we can move forward with testing right away. They will also be able to tell me at the geneticist why pain pills don't work for me. That's another kind of crux to this whole Chiari malformation business. It's terrifying when you know that nothing is going to help. When taking handfuls of narcotic pain medications isn't working, fentanyl, morphine, hydrocodone, OxyContin, you name it, it doesn't work. And I had a lot of people looking at me like I was a drug addict because they're like, this is a really strong pain medication, you know, and this should work for you, and you're so small, how can you, you know, tolerate this stuff? And problem is it's not metabolizing through to my bloodstream properly, so I'm not getting the relief that I should be getting with pain medication, and that's a genetic defect. I'm not sure the name of it, but the geneticist will also be able to test me for that. There's some more things I wanted to talk about here. What a normal day for me is like, it's the same every day. It's sitting in our room, watching TV, playing board games with the family, browsing on Facebook, chatting with friends. It's pretty much my life now. Like I said earlier, I'd love to be out doing different things, but it's hard to even make it from the bed to the bathroom on most days. And I tried coming off of my pain medication because A, it doesn't work, and B, I don't like being on anything that can be addicting. And I don't want to have to put my body through more degradation with pain medication and narcotics and damage my liver and my kidneys because I'm told I'm going to have to be on it for the rest of my life. It's difficult when it just doesn't work. If it worked, that might be justifiable. But at this point, I have had to relent and decide to go back on the pain medication, whether it's working or not, because it's better, you know, even just 5% relief is better than none. My quality of life right now, I would probably say, is about 20% maybe, and that's probably shooting it high. I don't get to socialize much anymore. I don't get to do a lot of things that I used to enjoy. For instance, the restrictions are numerous. It's as long as my arm for people with Chiari malformation. And the reason that we have so many restrictions is because after having the surgery and being decompressed, now there's more room at the base of your skull. And if you do things like run, jog, if you ride a roller coaster or anything that jerks the head or the neck around, riding horses, going mudding in a truck or whatever, it's not allowed because any jerking or sudden movements of the head could cause the brain to slip out further, crushing the brain stem and causing death instantaneously. So people that know me really well know that I'm a roller coaster fanatic. I've said it over and over and over again, how I'm lamenting the loss of my beloved roller coasters. I've made peace with that. It's something that I cannot control. It is nothing that I can do to change it, so I just had to let it go and say, I at least got to enjoy it when I was young, and most people never get to ride one a day in their life, so I count myself blessed. My pain levels are inconceivable to most people, and I do my best to try and say, oh, I'm fine, or, I'm just hurting a little. But inside, I want to cry for days because the pain is unreal. There is no even 1 to 10. On a scale of 1 to 10, how bad are you hurting? 12? 20? Does it go that high? It's very, very difficult when you're literally clinging to consciousness, literally trying not to pass out because the pain gets so intense that fighting just to stay conscious is actually a thing. It's frightening because when I do lose consciousness and I come back, I have a harder and harder time. Or let me put it differently, it takes me longer to realize where I am, what's happened, and I get very confused. My short-term memory is being affected by this Chiari malformation. I've noticed simple things, like a pencil, for instance. I can look at the thing and know exactly what it is, but the word will just escape my mind, and it'll literally take me sometimes minutes to grasp onto that word. Like I said, I'm going to be seeing a geneticist, and I'm going to be seeing my neuro surgeon again, and also my neurologist. I'm also going to be doing what's called gait training physical therapy. And what that is that they're basically going to teach me how to walk all over again. I've lived with this all my life, and it has defined who I am. Another little known fact about Chiari is it can cause rage fits because you're living in such excruciating pain day in and day out, 24/7, 365, your entire life. You're going to get a little grouchy. That's just how it works, and we're prone to having temper flares because enough is enough, and we tend to lose our patience sometimes a little too easily and find ourselves asking for a lot of forgiveness. It is very hard. It means living with a headache every day of your life for the rest of your life. I still have headaches every single day. I don't know what life is like without a headache. I don't, and I probably never will. I wanted to bring up things that you should avoid saying to people with a lifelong debilitating illness or condition, because I've had so many of my friends, and it's not really you guys' fault. It's why I'm trying to bring awareness in this way, so that I don't have to keep repeating myself, and so that maybe you can learn how to approach it correctly or what to say, because I know it can be very difficult knowing what to say to someone in my condition, or a loved one or a relative, or anybody, really, a friend. So not to get all soapboxy, but there are some things that we just don't like hearing, and it's not because we're being jerks or we're not appreciative of the sentiment or the thought. Believe me, that we understand the sentiment and the thought, it's there, but it can come off as a little insulting sometimes when people say things like, others have it worse than you. Yeah, a lot of people have it worse than me, but this is my own personal hell, and it hurts on a constant basis. My life was taken from me as I once knew it, and it doesn't really matter that there are people out there that have it worse than me. I mean, it does, but to me, that doesn't make me feel any better, because if you only knew that I'm one of those people out there that have it worse than someone else. And my own personal hell is that. It's hell. And it's hard to get somebody to understand just how draining and life-taking living with something like this can be. And a little kindness, a little forethought into the words that you say will really just make a difference in someone's day. You never know. I mean, the suicide rate alone of people with Chiari malformation is way too high. It is, even one would be way too high, but it's devastating because it's very hard to live with, and some people just can't handle it. And that's how I feel about when people say others have it worse than you, or I hope you feel better soon. It's not that we don't appreciate you wanting us to feel better. We want to feel better too, but we understand that that's probably not going to happen. I mean, there's varying degrees of how you feel like crap or really, really like crap, depending on that day, you know, I hope you feel better soon. I'm not ever going to get better. I'm never getting over this. It's not the flu. It's not a sprained ankle. I'm going to live this way for the rest of my life. It's like being told you have cancer, only you're not going to die from it. You're just going to suffer for a really, really, really long time. Lots of pain and various different symptoms, vomiting, nausea, in and out of doctor's offices, constantly having to answer questions, be under scrutiny every step of the way, especially if you're applying for disability or you have disability. It's about convincing people that you're actually sick. It's not just about a diagnosis anymore. Having a diagnosis isn't enough. They have to believe you're actually sick. How about if you tried doing things, you might feel better. Like if you tried exercising, or if you quit smoking, or if you quit eating so much junk food, you might feel better. Well, in reality, no. Nothing is going to make me feel better because I have a crushing condition that's going to be with me for the rest of my life. People that eat junk food, I guess I'm kind of guilty of it myself, I love my comfort foods when I'm feeling super, super crappy. Come to find out recently that my whole circulation problem, an upped salt intake is actually recommended. And well, I've heard them say, or I've heard it said before, that whatever you're craving is actually what your body is needing. And so that's our body's way of letting us know what we need. And so that's probably why I prefer a lot of salty things, or things of that nature. And we can't work out because guess what? No running, no jogging, no lifting anything over 5 pounds, no straining yourself in any way. I mean, people with Chiari aren't even allowed to strain when they go to the bathroom. So working out is definitely right out. And I am a devout Christian. I have faith. I have a personal relationship with my Savior. But one of the things that I don't like hearing so much all the time is pray more. Believe me, nobody prays more than I do. I pray my little heart out because it's one of the only tools that I actually have. And I pray for miracles. Now, I know that God isn't going to come down and tap me on the head and make my head bigger or shrink my brain. I know that miracles do happen, but I believe in more realistic miracles, like the miracle of not having so much pain one day, or being able to be more active, or get back pieces of my old life that with restrictions I can manage easily, having a social life, being able to get out of the house or do more things with my kids, clean house like I used to. Oh my God, I was such a clean freak. I love to clean my house and keep it clean and organized, and now my condition won't let me do that, and it drives me insane. So believe me, nobody prays more than I do. I pray for miracles like pain-free days, and I pray for good results from the doctor and successful procedures, and understanding, caring doctors. Those are the miracles that I pray for. I do not also like it when people say, don't worry, you'll get better soon. And you know that how? I mean, this, again, isn't something that you're going to get better from. So, you know, saying, don't worry, everything will get better soon, or, you know, I'm all for keeping an optimistic attitude, but I am a stark realist. I believe in what is fact. I believe that, you know, I am optimistic to a point at times, but when it comes to very serious things, I am a realist through and through. I just believe it is what it is. You can't argue facts. So when I hear, you know, you'll get better soon, it's like, no, I won't. But thanks anyway. You know, I understand the sentiments there. Also, when people say, I don't know what to say, or what do you want me to say? That can come off a little brusque and abrasive, to be quite honest. We're not asking you for a speech. We're not asking you to tell us how brave and strong we are, or, you know, that we're awesome. We're not fishing for compliments. When we talk to you about our day, or when you ask us how we're feeling and we tell you, don't be surprised if we're talking about our condition, because that is our life. It is all our life is Chiari malformation and the pain that comes along with it. Chiari is like an umbrella. The sister conditions come with it. It's like saying, oh great, you get this crushing, debilitating life illness, and here's a few sister condition gift with purchase. Good luck. Or hearing from someone that, you know, is your friend or your family or somebody that you really, really care about, and you hear, I'm tired of hearing about it. I'm tired of living it. Part of being my friend or my support system or my loved one means that you're going to have to accept that this is who I am, that I'm going to be sick for the rest of my life, that I won't ever get better, that, you know, it's very difficult, and I'm sorry if that's all I seem to talk about. I mean, truly, I am apologizing right now and saying I'm sorry if that seems to be all I talk about, but it's all I have to talk about. I don't have a day to talk about, well, how was your day? You know, I don't have events happening in my life. It's just the same thing every day. And I want to be able to communicate with my friends. I want to be able to have conversations, but it becomes hard knowing what even to say, because you know they're going to ask you, well, how you doing? Or how you feeling? Or how's it been? Or how's it going? And you're just like, well, kind of, you know, I'm not a liar. I'm going to be honest. So if you ask me how I'm feeling, I'm going to tell you. That's just, you know, and if you can't handle it, then, you know, maybe you shouldn't be my friend. But that's all I have to say about that topic. If you have more faith is another one. I have so much faith. Faith is coming out of my ears. I have lots of faith. Like I said earlier, I'm very close with my God, but it's something that I also had to accept by saying, you know, God gave this to me, or I have this, and it was just my destiny to have this condition. So it's not like he's going to go, oops, I made a mistake when I made you, and come down, let me fix that. No, that's not going to happen. Like I said, I do believe in miracles. I believe in very, very real miracles, but, you know, there is something very defined that happens when you live with this condition for as long as I have, almost 36 years now. A degradation of the body starts to occur. When you're living with nerve compression for so long, it can really cause chronic problems in and of themselves. Some people report fibromyalgia, multiple sclerosis, scoliosis, just to name a few, Crohn's disease, mast cell disorder, mixed connective tissue disorder, things like that. So to bring it on a more positive note, here are some things that you can say, or that are more socially acceptable in the chronic illness community, instead of the negative ones that I just mentioned.